5:04, we are going to call the meeting to order. The first thing I wanted to do is just have everybody go around and introduce themselves, because we have some new people. Hey, show. Do you want, you're okay for this?
Sure. No problem. Thank you. Sorry, I'm late.
We have some new members and we haven't seen each other for 3 months. So if everybody wants to go around and introduce themselves. I'm Judy Gardner, Executive Director of Stafford Family Services.
I'm Tony Frasnelli, First Selectman.
I'm Charlotte Henson, member of the advisory board.
I'm Valerie Gerard, and I'm a student representative from Stafford High School.
I'm Caitlin Kirchhoffer, and I'm also a student representative from Stafford High.
I'm Cheryl Vale, member of this committee.
Carol Davis, a member of this committee.
Brenda Henderson, Office Manager of the Stafford Family Services.
Tom Duncan, lieutenant with the police department.
Pat Collins, Superintendent of Schools.
Deborah Winicki, one of the members of the board.
Great. We're being taped on Access. I asked them so not to look at me because I didn't win. So I might look like I'm hiding behind people.
Yeah, then we know why.
There's a scene from Friends where they said, Monica, you're so fat. She's like, well, I was like, you're way more on the camera. I'm like, oh my God, how many cameras?
Oh, God.
So that's what I feel like. I just passed out the copy of the minutes. You all had them emailed to you, but here's just a copy for review if anybody had any corrections to be made to them. Or any questions about them?
I didn't have a correction for the minutes, but there is my contact information on that list of
Yes.
bishops.
Is it wrong?
Yeah.
Okay. Can you just write on it, because I had Pat's address wrong apparently, so I emailed.
Only off by one.
Only on. And who
16
knows
hours.
where I came from. I came from that.
Sure.
And you guys sent me your stuff. I sent you out a list of who was on the okay. So yeah, if anybody sees things that are wrong, please,
Okay.
that's great. Are we allowed to go out of order? Oh, so first, I guess I need a motion to, anybody wanna make a motion to approve the minutes?
I make a motion to approve the minutes.
Second it.
All in favor?
Aye.
Anybody opposed? Abstentions? Great. So we're gonna skip around on the agenda for a second because the first selectman who's gonna speak is not here. Give you a brief update on the agency licensing. So, as most of you know or from the reading, we've been working extremely hard to get licensed by DCF and DPH as an outpatient psychiatric clinic. It allows us to do two things. It allows us to have a prescriber, which means that people could get their psychiatric medications here, and it also allows us to change our billing process so that we can bill for the interns that we have working here. So DCF came out for their final pre-licensing visit 2 weeks ago, and we're waiting for one small document of somebody's getting their TB test done, and we will send out the format and we will get the license.
Well,
And then, so we need one more chair.
I'll grab it, Judy.
Thanks, Brett. Hi, I'm Judy.
Nice to meet you, Damon.
Hi, Damon, it's nice to meet you. Do you want us to go around again and introduce ourselves so you know who we are?
Yep.
Or, yeah? Okay, so I'm Judy Gardner, I'm the Executive Director. Tony Frasnelli, the first selectman, is sitting here, so when he gets back
He'll
to
sit
the
on
next.
your lap when he
he'll-
comes in.
he can do that. Charlotte, you wanna go back around again?
Oh, sure. Hi, I'm Charlotte.
Hi.
Member of the board. Nice meeting you.
I'm Valerie from
Caitlin, student representative.
Cheryl Vale.
Carol Davis.
Tom Duncan.
Collins.
Deborah Winicki.
So we, just reviewed the minutes and we're skipping ahead in the agenda, just until Tony gets back in. So, the DCF licensing will be in place, which allows us, again, so we'll become an official outpatient clinic, psychiatric clinic for children is what it's called. So again, our services here don't change, we still get to take whoever we want, we serve people whether or not they have insurance, all of those things stay the same. It just changes for us, the billing, and again, having a prescriber. So two things changed to make that happen. One is we had to hire a medical director, which we did, because that's a requirement by the state. And he has to see clients, so he came 2 weeks ago, so we actually had our first 2 clients seen, that have identified mental health issues that need medication. And
Who's the doctor?
his name is Dr. Mubashar. It's Sabu Mubashar. He's actually, he lives in Woodbridge, he works in Sharon, he works all over the state, but he said he felt sorry for us because we're so far away. And there's just no psychiatrist here that just did it. And he works with a lot of outpatient clinics and a lot of residentials. And the benefit is that he's not only licensed as a child and adolescent psychiatrist, he's also licensed as an adult psychiatrist.
Oh.
Because we need that for the DPH license. So the only thing that we need to do for DPH is finalize an agreement with Johnson Memorial, which is just a memorandum of understanding that says that if we need to refer clients to their emergency room or for inpatient care, they will accept them. And I'm drafting that today. I just had a conversation with Stu Rosenberg's assistant this morning. And as soon as they do that, the first selectman gets to sign a document saying, his favorite thing, that he attests to the fact that we're gonna abide by all their policies, because they already license us. They're not gonna come out for a licensing visit, they're gonna give us a license. And then we are good to go. So it's very exciting. There was a lot of work. And we have new fancy files, because DCF didn't like our files. So we had to go buy
New
files.
Really?
That they, yes. Because they weren't organized in a way, like we just had a full, you opened it and had a panel here and a panel here. So now we have new files that have a panel here, panel here, panel here, and a panel there.
Oh.
So treatment plans and progress notes and medication notes, they're lovely.
They're all
Yeah.
organized.
We have, yes, and we all know everybody that has all their paperwork done.
Does security have to be increased now?
No, because the population that we're serving, to my knowledge, Lieutenant, isn't gonna change. All it does is allows our clients, instead of having to go to Enfield or Manchester or Willimantic to see a psychiatrist, they'll be able to see somebody here,
Which is good.
That's good.
which is, yeah.
Excellent.
And you have a question about that later that we're gonna, when we get to the erase thing.
Right.
Okay. Alright, we skipped the agenda, skipped around. So does anybody have any questions about the licensing or what it means? So DCF will come again in 6 months to do case file reviews where they make sure that everything that needs to be in the files, the chart files is in the files. DPH will come every year or two. They're not as rigorous in terms of monitoring as DCF is. And that,
Sounds like you did a lot of work to get that in place.
yes, many people did a lot of
Lot of
You
work.
did a lot of work.
I did a lot of talking. No, I just talked.
You did all the work.
So, thank you. Tony, yes, I just wanted to give you a chance to.
Sure, and I appreciate everybody being here. Having met Judy only a couple of weeks ago now, and understanding what she's gone through with DCF and the hoops they kind of put her through, I think we've got a pretty good understanding that this could be, and has been, a very, very successful interaction with the folks in the community that need this service. She's done a terrific job in the short term she's been here. I thought she'd been here for years. Little did I know, it was really 7 or 8 months. Along with Brenda and the new folks that we've hired, and DCF's requirements that have kind of changed how we have to run this place. I know that in years past, some time ago, it was at a level that I think we want to get to again, to be able to help everybody in our community as opposed to them going elsewhere. I support her 100%, along with Brenda and the whole group here. I have not yet met the doctor, but I heard good things, and I think we're on the right track. And now that we've gone through the DCF issues, we're ready now to start to really move forward in creating a place here that's going to take care of exactly what we need regarding the services within the community, and they're pretty great to some degree. And I want to commend her and her folks here and what they've done. So I look forward to us working as we are and then expanding, and this really becoming what we envision for the town.
And then I'll go to the budget cuts. So The one thing that has happened is, as you're aware, there's been a lot of budget cuts by the state. So far we've been cut about $1,000 from SDE, which funds our Youth Service Bureau component of the clinician activities. We've been very lucky. We have not had any cuts this year yet from DEMIS. And that's an $83,000 grant that we get every year from them to provide mental health services.
83,000?
Yeah. They're a
Wow.
very big funder and supporter of us. 83.
It was actually 95,000.
Yeah, it was cut
Really?
last year.
Yeah, they
was
cut it last
year.
year,
Boy,
they cut
that's a lot
over
of
$12,000
money.
Yeah.
last year. Halfway through our budget, they
My
cut
city
12,000.
this year.
Yeah,
Boy.
so I'm
So
concerned
far.
moving forward. And that money just comes to us, we don't reimburse the state for anything that happens.
Right.
So as a reminder, the money that the town gives us, which is significant, any money that comes in from insurance payments goes back into the general fund.
Okay.
So we try to, the goal is to have the town give us money and then have us pay it all back by the end of the year.
I like that goal.
Yeah. That's good, so when you
It's a
see
good
my
way to
budget,
start,
yeah.
I'm sure.
Well, I won't all be back until June, but some of it. So that's why the DCF and the DPH licensing is so important, because that allows us to
Yeah.
collect additional money and give it back to the town, so that's a real bonus. The first selectman knows that he's been making some phone calls up to the state rep and the state senator to just try to remind them how important the money is
Yeah.
that comes in. And there's a lot of lobbying that goes on. There's statewide associations for youth service bureaus, and there's statewide associations for they're called CACs, the catchment area, for the DEMIS mental health things, and so they all hire lobbyists who all go and speak up at the general assembly also.
Sounds good.
Alright, so, this is the current update, so this is still, nobody likes my format, so I'm gonna apologize yet again, that I can talk, I cannot do math, computers, whatever else. So, you saw something like this 3 months ago
Yeah.
that was just the 3-month update. So now this is the almost 5-month update, because we did it, Brenda and I finished it right before Thanksgiving, so it doesn't have any payments that may have come in on Monday, excuse me. So, how about I just let you take a look at it first, and then I'll tell you the things that are significant. Okay, so I know it makes no sense. I
Well,
write it and I don't know it, some of it does, sort of.
Some of it does,
So
yeah.
the one thing the first thing that's important is in that second level where it has number of cases. So we've had 110 new cases opened since July. Now, a lot of the people haven't stayed, so they'll come for an intake and then they don't stay, or they get incarcerated, or they go different places. But we basically have about 5 new cases coming in a week, and it's really mixed between individuals and children and families and couples and just a whole bunch of, and 95% are Stafford residents. I would say we have some people from Wellington and some from Union, but almost everybody's in town. And I think you all know, people can leave and come and be very fluid here. We're not like the larger places where if you don't make your appointment, then your case gets closed. We have the flexibility to let people sort of do what they need to do. So, I think it's good that we've had that many come in so far. It does, so all our clinicians and interns are they're operating all the time. The other thing that's important is that so far, we've made back $33,000 from insurance payments. For all of last year, it was 53,000, so if we're on pace, we'll do more than we did last year, at least. And we should do more once we can start billing for more. So the thing that doesn't make sense is that the negative 33,452. So as we make money, then it starts to offset the town contribution as it comes in.
But it's not gonna offset it though until we start reimbursing more of our Husky clients.
Right,
With,
right.
with our DCF
With the doctors,
license.
right,
We'll
right. But-
double our monthly income.
Yeah, so we
Once we
project
have
right
that.
now, I'm gonna go with Tony's permission, go before the Board of Finance on Monday, cause we have a budget request in to pay for the medical director. And we project that we'll be able to bill about another $9,000 a month with the new licensing. So
That's good.
that's, yeah,
Right, so it offsets the cost immediately, really in the first month, and from there.
right, and then from then on, it just is a bonus to the town.
It's a win-win.
And that's why, so you'll see in the budget, that contracted medical director, you didn't see on the last one, cause we didn't know we needed that the last time. So, if people have ways to make this more usable to them and wanna suggest it to me, that would be fine, cause I know it's, poor Charlotte, really just, she just like looks and she's like, oh my god.
She won't use Excel.
I
If you want it
can't.
on Excel, I'd be happy to
Alright.
do it for you.
I like, cause I make this little note and that little note and whatever. And Valerie and Damon and Kate, feel free to ask questions, cause I know that it's sort of like this doesn't make any sense. But if you wanna say like, why is it so much money, or where does all the money go, you can ask that question. If you want to. I mean,
Let's
it'll-
explain it instead.
I can explain it. So, we have 5 clinicians that work, and then 3 interns that work here. So the clinicians all get paid, and the interns don't. And so almost all the money that comes in, as you can see from the budget, you'll see we have to pay for phones, we have to pay for, like this is a town building, but we have to pay for all the services and the utilities in it. And then all the other money goes for staff. So it pays for me, it pays for Brenda, I see clients also, so I offset some of my own expense. And then it goes to pay the clinicians who see the clients. So that's how it works. And so the money from the insurance company that comes in is usually on a 3 to 4 week lag. So the money that like comes in July is really for June expenses, and so it counts like that. And then Brenda tracks it all and figures it all out. So you know, like when you guys go to the doctor and they bill your insurance, you get that little statement. We got the same thing for that. And then insurance companies pay us back different amounts. So if somebody has state insurance, an individual session we get $93. If they have Aetna and they have like a high deductible or a high copay, we may get $40 for the exact same service. So we're happy to accept their money, so that's okay. And then we also adjust. We don't take a very high copay from our clients because they can't afford it. We're not in favor of that. So that's what some of the grant money from the state is to us, to make sure that anybody that needs services can get services. And it's not, if you don't have insurance, you can still come here, and we just see for that. So that's important. A lot of other agencies don't have that flexibility, but because the town supports us, they give us that flexibility with that.
Judy, may I ask a question about the
Yeah.
interns?
Yep.
Is it similar to student teachers in that they are never, or that they're always in a supervised situation, so there's a clinician with an intern
Nope,
and
they're-
family?
And by themselves. So these are master level interns. They've all graduated. They're in the 3rd year of their program. We have interns from St. Joseph's, UConn, and Southern currently. And they are supervised every week with with an approved supervisor. So the other thing is, to be a marriage and family therapist, you have to be supervised by somebody that's been an approved supervisor. You have to go through training, and you get monitored, and you have to do all that. So they see clients on their own once we feel that they're ready, and they actually, because of DCF, they get what's called credentialed now, where they can see certain people and certain clients based on their level of experience. So we don't necessarily start them off with families, and we don't start them off with very difficult cases. Those would go to the licensed clinicians, but the model would not work otherwise. and clients feel uncomfortable with two people in the room, with two therapists in the room. A lot of people, they'll make a relationship with their clinician moving forward.
Okay,
And-
it is similar to teaching in that teachers that have student teachers have to go through specific training as well.
Okay.
You
But
can't
they're
just-
always usually in the room, they don't usually leave
Right.
the teacher alone,
Right.
right?
Right, I mean, maybe toward the end, you might see a student teacher running,
Like a
a class,
different
so.
activity, yeah.
Can I ask you also, what is the turnover rate of the interns?
They are here for a minimum of 12 months until they complete their hours. They need to have 500 clinical hours, 250 individual and 250 families. So most of them stay a year, some stay longer. So one of our interns is only here 7 or 8 hours a week because she works full time. So we'll get to have her for almost 2 years probably because it'll take her that long to make her hours. So they stay for an extended period of time.
I have
And-
I have a question completely off that topic. I'm sorry, was it more regarding that topic? And I'm a numbers driven kind of guy. So I'm looking at actual versus budget, and just looking on the surface, they didn't add up in my mind that the budget was actually greater than the actual. And they don't. So I'm curious, were there,
What was, that was the 2000, that's
That's
last
last
year's,
year's.
that's 2014's budget.
right? This is,
Right.
this is the actual,
From last year.
Yep.
And then this is the current to date.
okay, so we budgeted here, but again, those numbers on the right, under budgeted, don't add up to 366, that's what I'm saying.
Oh, they don't?
They add up to 301, so that's why I'm,
Oh, good.
I'm a little, it's
You're a little
301, the
confused?
493 is absolutely correct. But
That's
the
good.
366 is actually 301, so I'm only curious,
That would just be me not being able to add.
was something transposed, or, so actually budgeted less than I have to be concerned with at 366?
One thing that we do is, with our budgets,
Yeah.
we always use all of DEMIS money, that our grant money, and all of SDE money. We use the town money basically for the lights, that, all the
Sure.
specific, things that need to be paid, but for like the contractual services
Yeah.
and clinical supervisor, we try to use all the other money before we use that, so we always have town money left over that goes
Okay.
back to you guys.
And I appreciate it, really
Do you
do.
have your calculator there?
Yes.
So if you add up, what do we get? 24,810 plus 83,555.
Yeah, bear with me.
But this is, are you adding last year's 2014, or you're doing
No,
15,
this year,
16?
for this year, for the budgeted.
Alright, what do you,
Alright, so you have those two numbers in already, or you want me to do them
give
again?
me again?
24,810.
Yep.
Plus 83,555.
Yep.
Plus, I can't subtract. Let's just do the 195. 195,443.
Okay.
What do we got?
303,808,
Okay, so that would actually be the budget amount, cause that's all the money we get.
okay.
Alright, so, right, this
Good
is not
news.
my, yep,
That's good news, you don't need 366, yeah.
Right.
I just saved you 53 times.
303,
That's why I'm here.
right, so that's good. So,
Okay.
and this is why
Perfect.
this is just
Just
not my
wanted to
thing.
make
That's
sure.
good.
This is a Word document, right? That's-
Oh,
that's why
absolutely,
this
it's a
is
Word
happening.
document.
Yeah.
Yes, one of the
No
reasons.
problem at all.
Also, I use like the calculator on my computer, I do things.
What-
So
it
when
worked in our
when I
favor
say
this time.
budgeted, those three numbers are the money that comes in. So the 24,000 is what we get from SDE, the 83,000 is what we get from DEMIS, and the 195 is what we're hoping to get from the town after Monday's meeting.
Absolutely.
And that's the money that comes in. So I have no idea.
What is this?
SDE is the State Department of Education, and that's the Youth Service Bureau money that we get from them. But they're the actual funder comes to the State Department of Education. So if any of you are math whizzes, and wanna help me with the budget, that would be fabulous, cause obviously I am a little lax in adding.
I like the way you had it worked out,
That's good.
so that's your math.
I
I'll
always
go with your-
over budget,
Worked out
that's better
better
than
than
under
Absolutely,
it.
I like it.
That's good. Okay. Any other questions about this fabulous document that I may not bring back until I have somebody that knows their math?
We're gonna do it in Excel next
And,
time.
There you
and run it probably by the
That's-
first selectman
there you go.
beforehand,
That's
there we
a
go,
good
that would work.
Keep it up, it's good.
This board reviews all critical incident reports and client grievances for the agency. We have none. So,
That's good.
that's good. All right, Lieutenant Duncan. And Superintendent Collin. So, Lieutenant Simmons and the superintendent are gonna talk about a race. As they're doing this, I'm gonna hand out some information that is part of this discussion, which is about heroin use and some increasing things, something from Demas about some different services that, the way to do it, and some other things about, that both two things that come from Demas, just mostly about heroin use and abuse. Because I think part of the school climate piece, Lieutenant, is about what's been going on, not just in Connecticut, but specifically in town. There's an article in the local paper that talked, there have been 10 heroin-related deaths in Talon County in the first 9 months of the year, and statewide there have been 69 people have died, and that is based on the fentanyl bad drug. But that's,
Can I see that?
yep. So either one of you can talk, because you know more about the race in the school climate survey.
I guess this is my topic.
I guess you're on, yeah, because I didn't prepare a presentation here.
Sorry.
I do not either, but I do want to, I guess. Erased is an organization that helps, it's East of the River.
Action against substance abuse,
Yes,
substance,
yes,
something like that, elimination or something.
Yeah.
They have probably 15 towns that belong to Erase, and Erase has a lot of different functions that they do. One of the things they do is that they score surveys, and what that is all the kids in the school at certain grade levels have a survey, and they actually fill it out. And when they fill it out, they take, like, don't quote the numbers, 5% of the top and 5% of the bottom, and they pick them out, and the other numbers are the actual numbers. We did it here in Stafford, probably 7, 8 years ago. And we targeted, after the survey, we targeted alcohol abuse. And we actually went out, we got grants to put extra patrols on. We rented billboards, we had bulletin boards made. I stood at the school today, I was at the school today, they stood at the school today. And we really concentrated on the alcohol abuse. We targeted night parties in the woods, in the houses.
I remember
Yeah.
you talked about that at the selectmen's meeting when we were
Years
working.
ago.
Yeah.
So now I do remember that.
This heroin issue has come up. I have no proof at all that heroin is in our school systems, none. The ages that we are seeing now is probably between 19 and 25. That's the ages that we are experiencing. Most of our heroin users and most of our heroin arrests are in that age group. But it's still not bad to find out what is the temperature of the schools and talk to the students, identify some of our shortcomings, and have a plan to make some corrections. But before we make a plan for corrections, we have to identify the problem. And the school survey will help us identify what the problem is. The catch to it all is, the last time we did this, the Board of Education did not want us to talk about the sex part of the survey. Because the survey is broken down into different sections. And one section has to do with sex. So the Board of Education said, you can do all the other surveys, but you cannot do the sex survey. So that was not included. When we did it last time, there's no cost to the town whatsoever. At this time, it's a $5,000 cost,
How much?
Wow.
$5,000
The survey?
to do the survey. But I think it's $5,000 well spent
Yeah, definitely.
if we can identify what direction we're going into.
Would that be the direction with the children at the school, or like
The high school.
freshmen to seniors, all
Yes.
4 levels,
Yes,
9, 10, 11, 12?
yes. Now, I will say, we had an incident at the school with a 16-year-old person, and he admitted that he is taking cocaine and is popping Percocets. So, we should not be naive in the fact that it's going on. But this year, help me out, Pat, I don't think we have any drug-related issues at the school this year, which is fantastic.
It is.
That's great.
Yes,
Town board, yeah.
Everybody knows.
Yeah.
and I want to say, on a side note off of that, I'm hoping to get a drug dog for the town, and that's also gonna help. I have some visions that I would like to see the town go into a certain direction, and me and Tony have to sit down and work out some numbers and see if we can make it happen.
Would that be for patrol, like in town?
It's
for
gonna be
adult?
it's gonna be a Labrador. The German Shepherd cannot search people. A Labrador can search people,
Ah.
because the German Shepherd can bite people.
Yeah, I was gonna
Oh.
say.
So liability-wise,
Lies, yeah.
it's something that, so I would like to see a survey done to get a temperature of what's really going on in the community. We know for a fact that 19 and 25-year-olds are in that heroin mix. I have people come to my office who are using heroin, and they come to me for help. I had a girl, last week, she graduated 4 years ago. And she remembers seeing me in the high school, because I'm in the schools a lot. And she came up to me in my office and told me she needs help.
Wow.
So,
Oh, good, she
That's
recognized
good.
that.
right, and that's part of us being in schools more.
Yeah,
Uh,
she was comfortable going to you,
Yeah.
which is a plus.
Right. But a lot of this is gonna be up to Pat, because Pat has to convince the Board of Ed, this is what we should do. And the $5,000, I'm not sure where that money's gonna come from. Because it
Right,
is,
like I talked to Lieutenant Duncan, because some of them, I thought, when it was gonna be a little less expensive, that technically some of the youth service bureau money could be directed towards that, because it's, I mean, we need to know, just like the schools need to know,
Yeah.
and the department needs to know, but we don't have $5,000 out of that money to do that. and I
Do you have
don't think we could-
$1,000? Do you have
$500, yeah.
We would have to
We-
look at the
We'd have
budget.
to look at the budget, cause we had to spend $600 doing state background checks for DCF. That was an unexpected expense, because they don't expect
Yeah.
the town,
I guess
Personal
we
journal.
can,
but we could, we could, if the board says, go look and try to find some money, we can go look and try to find some money.
Excuse me, I missed the survey, that's the survey for the high school or for the town?
Yeah. no, for the high school,
school.
only for the school.
Okay, because if most of the heroin users are 19 to 25, then, I don't know, would it be a good use of our money to survey
I-
the schools?
Right, I guess why I wanna talk to the schools is that's what's up and coming down the road. We have not had an issue, but we might have an issue that we don't know about. And when we did it 7 years ago, alcohol was developed as an issue. So we were proactive on the alcohol, trying to prevent it. I guess the students who are here, what are your thoughts?
Well, I actually did have a question, why is it so expensive?
The service.
Well-
It's just a survey, it sounds like.
The Erase is the one that does the survey, they come in, fill out the forms, they actually have to analyze the data, and then they print out their opinion of what direction we should be going into.
Right, with all the analysis with the graphs and, you know.
Well,
compares different-
actually, if you get a head start on this and you can get in the door, it's much better than letting this get a hold of some of the kids.
Well,
To be a step ahead of this.
Right.
That's what I think,
Yes,
it's really to
absolutely,
identify
yeah.
patterns,
I think
to
so.
help
I think
guide,
that's
you
why
know,
the
school
survey-
staff and students, to student groups in terms of how, you know, first of all, bring some level of recognition if there is an issue in what
Right.
that area, you know,
Right.
Tom mentioned, you know, we don't wanna deny, we shouldn't be in denial or fool ourselves that it doesn't
Right,
exist, it's
because
all over the
If
place,
it doesn't happen today, it could happen 6 months from now,
right?
you know, and, you never know, it could be your kid.
Well, it's
Well,
not, and our 18-year-olds are gonna be
exact-
19 next year,
exactly,
so they're gonna be in that,
exactly, you know?
in
Yeah,
that
but it seems
bracket.
like the heroin, it's not in the schools where there's, it sounds like it's a college thing, where.
Oh,
I think it's
I-
more in the schools than we're.
Well,
I
think
think
Really?
that,
It's in
Well,
the
again,
schools.
that's, Dana,
that's
what
what
are
you're
the
trying
students
to
saying?
find
What
out.
are you guys thinking? And you don't have to name names, but do you know
No,
kids
you're
in
not
your
gonna name
grade?
names.
Right.
Yeah.
I'm telling you,
Yeah,
you're not
yeah.
gonna name names.
You know,
You and I can have a conversation, you're gonna name, but anyway.
But do you hear people in the schools talking about doing harder drugs? And I wouldn't, at that age, in that environment, I'm gonna guess it's more of a pill issue than it's a heroin issue. Percocets, oxys. Do you hear kids in school talking about that?
Personally, my friends obviously don't, but
Right.
like, there's like a general group of students who I would assume do.
Right.
Because, not to be judgmental, but they've gotten in trouble so many times from just different things, and sometimes they brag about doing drugs or whatever. But I think mainly everyone, like not everyone, but those like general kids, like they only really talk about like marijuana, not like really, really hard drugs like cocaine or heroin.
Yeah, I'd have to agree with that. Generally, the climate in the school is like, most of the people in the school don't talk about drugs, and there's generally a good climate for like people encouraging people actually to not take drugs, to not get on alcohol or anything. But I'd have to agree that there would be a group of problem students that maybe would talk about using like marijuana or pot or some of these drugs, but beyond that, I think it's generally a contained issue. And in terms of alcohol, I wouldn't say for the vast majority of the people in the school that there's not an alcohol problem existent. There might be certain cases where we have people using alcohol, but that's pretty much a non-existent problem.
Yeah, I've on Facebook actually, part of like the group that would be into the drugs, they post about cocaine a few times, and one's posted about heroin once. But I believe that one of the students was expelled last year, so I don't believe they're in the school anymore, but they might have come back this year, I'm not sure. But that was only one student that posted about it, but I agree with Dan and Caitlin
Yeah.
that it's pretty rare, if any.
Also, I can notice this year, I actually heard those group of students talking about how the harder drugs were actually stupid, because I think they knew someone this past summer, somebody died in Stafford of a heroin overdose, I think.
A 19-year-old boy did.
So I think that really like affected people and woke them up, so that's it.
Yeah, and I just had a quick question with the looking at the drug dog. Would there be any expenses attached to like actually getting a drug dog for the town?
Well, the drug dog is multifaceted. The drug dog just need to be targeting vehicles or people who are bringing drugs into town. And if we do drug seizures or we take money from some of these vehicles, we're going to apply to the court system to keep the money.
Yeah.
A side note would be, again, I would have to confer with Pat and Board of Ed to let us walk through the schools every now and then. It will not be up there every day, it's more of a deterrent type of tour that we would use. But the main purpose of the dog would be targeting the people who are using drugs or selling drugs.
But what about the sporting events at the school at night?
We would take the dog when we have to take the dog to get the most bang for the buck.
Okay.
And part of my philosophy would be, it would be a deterrent And if we can deter people from doing drugs,
Exactly.
we wanna do that.
Right.
But we also wanna be aggressive with it,
Right.
in the sense of, if we know drugs are being used, we just target, you know, the drug dealers.
I think
So-
the athletic events are really kind of like the hot spot for drugs in high school. I know a lot of kids go to the baseball fields and do that because one time we had a field hockey practice really early in the morning and kids didn't know we did and they were there. So, I mean, we didn't like see it, but it was kind of obvious as to what they were doing. But
But these are same kids we have to try and target, and we have to try and get a climate of what they're doing. What type of drugs are they doing in the morning?
I don't
No,
know.
I'm not,
Oh,
I'm
I
not
thought you were
saying
asking me.
I'm not saying that, what I'm
I
saying
was
is
like,
the survey, but the survey will answer some of those questions
Oh,
for us,
right.
if my point.
I think and Tom and I have met before, we talked about the drug dog, matter of fact, I brought to him part of why I was, when I came into office, one of the things I needed to address, I know there is an opiate heroin issue in town, and the state police readily would admit that. So the question is, at what level is it? Do we not, put a survey together that can address our high school kids separate from a race or not having to follow the race? I think it's more educational when we start at the middle school level, and I think Tom would agree. Because we can't be naive to think that it's not in the schools. I think you may not have proof yet, but I think you just haven't caught anybody. So, to that end, I think we're right on target, and I signed off on actually getting this, this officer in the training, in the canine training for, down in Meriden, I think, or Middletown. So I've already said that, yeah, there is an inherent expense, but we can't put a dollar figure on the safety of the people in town, so I'm behind him 100%. I think we figure out somehow to work together to put together enough information from the students at the school, and it may not have to be a specific race thing, especially if most of your data has not proved out that it's anywhere in that 14, 18 age group, but at least you will be able to get feedback just like these three individuals here. Similarly enough, a group of kids in the school system to know there are issues and there are things to investigate, and I think that's, along with our own police force, the state police as well, to see if we can come to some conclusion about how best we tackle the issue and what level is it. So, I'm behind the idea 100%. I met with the state police, similar